Alright, so I walk in, I introduce myself, I am Gavin, I'll be your student nurse today, and then I get your name and date of birth, you tell me that, check the wristband, that's 2 patient identifiers, and today provide for privacy, and after that I will be explaining the procedure, which today I'll be performing a clean dressing change on your wound. Then safety survey, bed is in lowest and locked position. Guardrails are up, non-slip socks are on, colleagues within reach, nothing's on the floor impeding their path. Then at this time I will be, checking the provider order and checking with the hospital policy on how to do this. And then also I have to be able to teach the patient and answer any of the questions the patient has, which the patient can't really talk because it's just an abdomen. And then I will be doing a pain assessment, and if the patient could talk, he'd tell me that. And then I also have to assist the patient into a comfortable position. It looks comfortable. And then after that, I will go and gather my equipment. I'm not sure if I should change my gloves here, but I'll do it anyways. I just touched a lot of stuff. This time I'm going to further prepare all of the stuff I will be using, so then I don't have to do it mid-procedure. Hardest part of the job right here. Now, dispose of the gloves. Wash hands. New gloves. And now I will be taking off the dressing using the push-pull method. And at this time I'm inspecting the drainage for the amount and the type of drainage that's on it, the odor and the color. And I dispose of it per hospital policy. Dispose of gloves, wash hands, new gloves, this out and I examine this for the same thing as last, which is the amount of drainage, the type of drainage, and then the color and odor. Disposing of it proper way. And then I'm also looking at the wound and assessing that there's red borders on it, which could say that there might be an infection. Best way to keep a wound clean would be maintaining a sterile dressing on it, and then antibiotics if needed. Now I will be assessing the depth, length, width, and depth of the wound. The length is 15 centimeters. The width is 3.5 centimeters. And the depth is approximately 3 centimeters. At this time, if there was any medications to be administered, I would do 3 checks and the 11 rights. But there's none to be administered, so I don't have to do that. Now we'll be cleaning the wound, folding the 4 corners in, and at first I'll wipe around the wound. Times on that. And after that, I will be cleaning the inside of it, which I start at the top and go down clean to dirty. And I'll do that a few times. And the amount of time to do this varies depending on the severity of the wound and if it's got like a bunch of stuff in it. Wash my hands. Don new gloves. This time I will be packing the wound. And when you're packing the wound, you don't want to put it in there super tight, but you want it in there good enough. And I will be applying the bandage. Closing on my gloves. Washing my hands. Putting on new gloves. The tape and putting it on like a window pane and making sure that this bottom one is high enough where it's not on the pubic hair, because nobody wants to have the hair ripped out. It's not fun for anybody, the patient and us. And I'm applying the tape like a window pane. As soon as that's done, take the gloves off, wash them, and now I will be putting on new gloves to write on the tape the time, date, and my initials. So the next person that comes, they know when it was done, so they have a good idea when to change it next. What's the time?
4:19.
9, 10, 15, 25, GW. Now I will document it, assess the response, and then wash my hands and put new gloves to dispose of all the stuff I used. And then at this time, I will be thanking the patient and leaving. And then cover the patient back up. Privacy.